The trauma bay at St. Catherine Medical Center smelled like antiseptic and fear. Nurse Elena Voss moved through it the way she moved through everything else in her life now. Slow, deliberate, controlled. Too controlled, according to Dr. Marcus Feld. "Voss, we don't have all night," he snapped, watching her check a line for the third time before adjusting the flow rate. "This isn't a spa. Move faster, or get out of my bay." She didn't answer. She never answered him. 3 years at St. Catherine and Elena Voss had built a reputation as the quiet one, the methodical one, the nurse who never rushed no matter how loud the room got around her. Some of the younger residents called her a ghost. They didn't mean it kindly. "She checks vitals like she's defusing a bomb," one had joked in the break room, not realizing she was standing right behind him. Elena had said nothing then too. She had learned, a long time ago, that silence was armor. That night, the doors of the emergency department blew open with the kind of violence that made every head in the department turn. Paramedics wheeled in a gurney soaked through with blood, a man's body strapped down and convulsing against the restraints, his skin the color of wet ash. Gunshot wound, chest, entry point left of sternum. The medic barked. "Blood pressure crashing. We lost pulse twice in transit. He's septic and cold." Dr. Feld was already moving, shouting orders, snapping gloves onto his hands. "Get me a chest tube kit. Get anesthesia down here. Somebody page cardiothoracic." The patient's dog tags slid off his neck and clattered against the gurney rail. Elena saw them first. She saw the eagle stamped into the metal, the unit designation beneath it, the serial number that meant nothing to anyone else in that room. It meant everything to her. Her hands, which had been steady for 3 years, began to shake. "Voss, line, now," Feld barked, not looking at her. "And for God's sake, move like you have a pulse for once." She stepped forward anyway, calm on the outside, her heart a hammer against her ribs. She started the line the way she always did, precise, unhurried, exact. Feld's frustration boiled over. "This man is dying, and you're moving like it's a Tuesday afternoon blood draw," he snapped, loud enough for the whole trauma bay to hear. "I don't know what school taught you this pace, Voss, but it's going to get somebody killed." The room went quiet in that particular way. Rooms go quiet when everyone is pretending not to listen. Elena kept her eyes on the patient's face. It was grey, slack, barely tethered to consciousness. And then his eyes opened. Not fully, not the way a healthy man's eyes open. Just enough. Just enough for him to find her face across the chaos of the room, past the shouting, past the machines screaming their alarms, past Dr. Feld's raised voice. His hand moved. It was barely a twitch, a fraction of motion that should not have been possible given his blood loss, his pressure, the amount of trauma his body had absorbed. But it found her wrist, and it held on. "Sir, you need to stay still," Elena said gently, her voice betraying nothing. His lips moved. No sound came at first, just breath, just the shape of something trying to be a word. Then it came, barely audible, a whisper thinner than the air moving through a punctured lung. Nightingale 6. The trauma bay kept moving around them, oblivious, but for Elena, the entire world tilted sideways and stopped. She hadn't heard that call sign spoken aloud in 4 years. She hadn't allowed herself to think it in 4 years. Nightingale 6 had been erased. sealed, buried under classification levels that weren't supposed to exist in a civilian hospital, whispered by a dying man who wasn't supposed to remember her at all, because the mission that gave her that name had never officially happened. Her face drained of color. Voss. Feld's voice cut through, sharper now, noticing the change in her. What did he say? Voss, are you even listening to me? She didn't look up right away. She was staring at the patient's face, really seeing it now, cutting through 4 years of scar tissue and memory to the boy underneath the blood and the beard and the grey pallor. Master Sergeant Daniel Reyes. Force Recon. The last man she had pulled off a table in a black site clinic outside Kandahar, with her hands buried inside his abdominal cavity, and mortar fire 200 meters out. Blood pressures 60 over palp. A resident called out. He's crashing! He's crashing! The monitors began to scream. Feld spun toward the crash cart. Push one of Epi. Get the... Stop! The word came out of Elena Voss like something unlocking. It wasn't loud. It didn't need to be. It cut through the room the way a blade cuts through water, clean, total, undeniable. Feld turned. Incredulous. Excuse me? He doesn't need epinephrine, Elena said, already moving to the patient's side, her hands finding his chest with a precision that hadn't been visible a moment ago. He needs a thoracotomy. Now, his heart's tamponading. The pressure won't come back with drugs. You'll just burn through the little perfusion he has left. The room froze. Feld stared at her like she had spoken in another language. You are a nurse, he said slowly, each word deliberate, as if reminding her, reminding the room, of the natural order of things. I didn't ask for your input, Voss. You're going to lose him in the next 90 seconds if you don't open his chest, Elena said, and her voice had changed. Gone was the quiet, unhurried nurse who never raised her voice. In her place stood someone else entirely, someone whose calm wasn't slowness at all, but the particular stillness of a person who had done this 100 times in far worse conditions than a fully staffed American trauma bay. Get me a scalpel, she said. Number 10 blade. Rib spreaders. Now. Nobody moved. Now, she said again, and this time 3 nurses obeyed, before their brains had caught up with their hands. Feld grabbed her arm. You are not doing an emergency thoracotomy in my trauma bay. Reyes's hand tightened around her wrist again, the last of his strength going into that single grip, and his lips moved once more. Let her, he breathed. Let Nightingale work. The name hung in the air like smoke. Feld's grip on her arm loosened, confusion washing over his face. What did he just call you? Elena didn't answer. There wasn't time to answer. There was only time to work. She took the scalpel from the tray herself, her fingers finding the 5th intercostal space, with the kind of certainty that came from having done it in tents, in the backs of trucks, in a concrete room in a country whose name was never printed in any newspaper. Betadine, quick prep. We don't have time for a full drape, she said, and made the incision. The room gasped as one. Blood welled, but she was already past it, her hands moving through the layers of tissue with an economy of motion that belonged to a surgeon 3 decades into a career. Not a nurse who had spent 3 years quietly checking vitals in a suburban hospital. Rib spreaders, she said, and someone put them into her hand without question now. She cracked the chest. The sound was wet, and terrible and final in the way that sound always was, and several of the residents turned pale, and one nurse near the door had to grip the wall. Elena Voss did not flinch. Her hand slid into the chest cavity, found the pericardial sac distended with blood, and with 2 precise motions opened it, releasing the pressure that had been strangling the heart from the outside. The heart, freed, gave a single desperate lurch, and then began to beat. Not strong, not steady, but beating. Pressure's coming back, someone called out, disbelief cracking through the clinical tone. 70/40, 80/50, she's got a pulse, she's got a pulse. Elena kept her hand inside the chest, massaging the heart directly, counting under her breath, in a rhythm that had nothing to do with any protocol taught in any American nursing school. I need thoracic surgery down here in the next 4 minutes or he bleeds out from whatever's still torn in there, she said. Not looking up. Somebody get me a Foley catheter. I need to tamponade the entry wound from inside while we wait. Feld stood frozen at the edge of the room. For the first time in 3 years, he had absolutely nothing to say to her. Dr. Aaron Whitfield, head of cardiothoracic surgery, arrived at a dead sprint less than 90 seconds later, took one look at the scene, and stopped dead in the doorway. "Who opened this chest?" he demanded. "I did," Elena said. "You're a nurse." "I am currently the only person keeping this man's heart pumping with my hand," she said. "We can discuss my job title after he's stable." Whitfield, to his credit, moved. He scrubbed in place at the bedside, gowned by a nurse who was shaking so hard she dropped the first pair of gloves, and took position across from Elena. "Talk to me," he said. "What am I looking at?" "Single gunshot wound, likely 9mm, entry left of sternum at the 4th intercostal space," Elena said, her voice flat and clinical, the voice of someone reciting a report she had given 100 times before, in 100 worse places. "Pericardial tamponade, now relieved. I suspect a partial laceration to the left ventricle, controllable with digital pressure, but he'll need repair. No exit wound noted. Round may still be in the thoracic cavity or lodged near the spine." Whitfield stared at her. "That is not a nurse's assessment," he said quietly. "Dr. Whitfield, with respect, right now I need you to trust the assessment and not the person giving it," Elena said. "We can have this conversation later." "He does not have later, if we don't move now." Whitfield looked at Feld, who gave a single stunned nod, and then he looked back at Elena and made his decision. "Talk me through it," he said. "Whatever you're seeing, I want to hear it." Together, they worked. Elena's hand guided his through the repair, describing the angle of approach, the tension on the suture line, the pressure points that would matter in the next hour when the patient's own blood pressure began to fight against the stitches. It was combat surgery translated, in real time, into the language of a civilian operating theater, and every person in that room, who had spent years training in sterile conditions with backup and time and resources, understood, without anyone saying it aloud, that they were watching something they had never been taught and would never forget. 40 minutes later, Master Sergeant Daniel Reyes was wheeled toward the operating room for definitive repair, his heart beating on its own, his pressure holding, his color returning by degrees. He was going to live. The trauma bay exhaled as one organism. Elena Voss stood at the sink, scrubbing blood from her hands and forearms with the same unhurried precision she had used all night, and for the first time in 3 years, nobody in the room looked at her pace and called it slow. They called it something else now, though nobody said the word out loud yet. Feld approached slowly, like a man walking towards something he wasn't sure was safe to touch. "Nightingale," he said, testing the word. What is that? Elena didn't turn around. A name I haven't used in 4 years. That patient knew it. He said it like it meant something. Like it meant everything. It did, she said. It does. Voss, Elena, she corrected quietly. You've called me Voss for 3 years like it was a rank you were revoking. My name is Elena. Feld was silent for a long moment. I owe you an apology, he finally said. I've spent 3 years telling you that you were too slow. Tonight you moved faster and cleaner than anyone I have ever operated beside, myself included. I was wrong. I am sorry. It wasn't the apology that undid her. It was the question that came after it. Who are you, really? Tell us in the comments where you're watching from tonight, because what Elena said next was something she had never said aloud to anyone in this hospital, in this country, in this life she had built out of silence and slow, deliberate movement. My name is Elena Voss, she said. Captain, United States Army, Medical Corps, retired, forward surgical team, attached to a Joint Special Operations Task Force designation I am not cleared to say out loud in a public hospital. Call sign Nightingale 6. I ran a 2-person surgical team embedded with operators in places that do not appear on any map you've ever seen. Sergeant Reyes was my patient. More than once, the last time, outside Kandahar, I opened his chest on a folding table with mortar rounds landing close enough to shake the walls, and I promised him he would walk out of that building alive. And he did, Feld said. He did, Elena said. But 6 weeks later, my unit was overrun during an extraction that should never have happened, based on intelligence that should never have been wrong. 4 of my patients died on tables I couldn't get them off in time. Command called it an unavoidable casualty event. I called it what it was. Which was? A setup, she said. Somebody wanted that convoy hit. Somebody sold the coordinates. I filed a report naming names I probably shouldn't have named, and 3 days later I was quietly discharged for psychological instability. My clearance was revoked, and every official record of Nightingale 6 was sealed so deep that even I couldn't access it anymore. Whitfield had come to stand in the doorway, listening, his surgical cap still on, blood still drying on his gown. That's why you're here, he said slowly. Working as a nurse. Hiding. I came here because nobody looks twice at a quiet nurse who moves a little slower than everyone else, Elena said. I built a life around being unremarkable. It was working. Until tonight, Feld said. Until tonight, she agreed. It was nearly 2 in the morning when the man who wasn't supposed to exist walked through the hospital's front doors wearing a grey suit and a visitor badge that had clearly been printed under a false name. Elena felt him before she saw him. It was an old instinct, the kind that never really left the body, no matter how many years passed, the feeling of being watched by someone who had once given her orders. Colonel Gerald Ashcombe stood at the nurse's station with the patience of a man who had never once in his life had to raise his voice to get what he wanted. Captain Voss, he said, when she approached. It's been a long time. It's Elena now, she said. And you shouldn't be here. Your patient's vitals triggered a flag in a system that hasn't seen activity in 4 years, Ashcombe said. Fingerprints on a surgical consent form, cross-referenced with a database that most people don't know exists. It took less than an hour for that flag to reach my desk. I imagine it will take considerably less time to reach other, less friendly desks. Reyes, Elena said. You knew he was flagged. You let him get shot anyway. I didn't let anything happen, Ashcombe said, and for the first time something flickered behind his careful composure. Sergeant Reyes has spent the last 4 years trying to find proof of what happened outside Kandahar. He got close. Close enough that somebody decided a bullet was cheaper than a court-martial. Elena felt the floor tilt beneath her again. You're telling me this wasn't a random shooting. I'm telling you that the people who sold that convoy's coordinates 4 years ago are still active, still protected, and very interested in the fact that their loose end just walked into a hospital and found the one person who could keep him alive long enough to talk. Ashcombe said quietly, I'm telling you they will not want him talking. And now that you've resurfaced to save him, they will not want you talking either. Then why are you here and not them? Because I've spent 4 years trying to fix what I helped break, Ashcombe said, and there was something in his voice now that hadn't been there before. Something like shame. I signed off on the report that buried you, Elena. I didn't know what it would cost until it was already done. I am here to give you a chance to finish what you started. Or you can walk away again, and I will make sure nobody ever finds this hospital, or you, or him. Behind her, the doors to the recovery ward hissed open, and a nurse's voice called out in alarm. Dr. Whitfield, room 4. He's seizing. Something's wrong with his pressure. Elena didn't wait for Ashcombe to finish whatever he had been about to say. She ran. Reyes's body was arching against the restraints when she reached his bedside, his monitors screaming a rhythm that shouldn't have been possible less than 2 hours after the repair, his blood pressure a wild, erratic line skidding towards 0. What happened? She demanded. His pressure just dropped. He was stable, and now he's not. We don't know. Check his line, Elena snapped, already moving. Already scanning his body with the particular fury of someone who suspected sabotage before she suspected complication. Check every line, every bag, everything hanging on this pole. A nurse pulled the IV bag and stared at it, confused. This isn't ours. This isn't the bag we hung. Somebody swapped it, Elena said, and her voice had gone cold and flat in a way that made even Whitfield step back. Get it off him now. Push calcium chloride. He's being poisoned. Get me the crash cart. They worked in a blur that Elena would only half remember afterward. The room narrowing down to Reyes's face, and the numbers on the monitor, and the sound of her own voice, giving orders that people obeyed without question, because there was no more room left in that moment for doubt. Minutes stretched into something outside of time. Then the rhythm steadied. Then it held. Reyes's eyes opened again, clearer this time, and found her face across the chaos exactly the way they had before. Nightingale, he rasped. I'm here, she said. You're safe. They tried again, he whispered. Told you. They don't want me talking. Ashcombe appeared in the doorway, his face grim. The man who swapped that bag is a hospital orderly hired 6 weeks ago, he said. Background is fabricated. Security's holding him now, but he won't talk, and there will be others. They know he's stable. They know you're the reason. Feld, standing near the wall with an expression of a man who had walked into a different universe sometime in the last 3 hours, looked between them. What is happening in my hospital, he said, not really a question anymore. A war that never officially happened is finishing what it started 4 years too late, Elena said, and I have a choice to make. Ashcombe stepped further into the room. "There is a program," he said. "Classified, still forming, designed to give combat medical personnel like you a legitimate path back into service without burying you the way we buried you before. Full clearance restoration, command of your own unit. But it requires you to step forward, publicly enough that it becomes politically difficult for anyone to quietly disappear you or Reyes again. It requires you to stop hiding. Or you walk away tonight, and I do everything in my power to protect you, and you spend the rest of your life waiting for someone braver than that orderly to finish the job." Elena looked down at Reyes, at the man whose heart she had held in her own hand twice now, 4 years and 1 gunshot wound apart. He managed a small, exhausted smile. "Whatever you choose, Doc," he whispered, "I already know it's the right one. You always made the right call, even when command didn't like it." Elena thought about 3 years of moving slowly through hallways, of making herself small and quiet and forgettable, of building a life out of the negative space where Nightingale 6 used to be. She thought about the 4 soldiers she hadn't been able to save, and the years she had spent believing that failure was the truest thing anyone would ever know about her. And she thought about the last 2 hours, about her hands moving through a chest cavity with total certainty, about a room full of strangers watching her become, for the first time in years, entirely herself. "I'm done hiding," she said. Ashcombe nodded slowly, something like relief crossing his face. "Then let's finish this properly. There are people who need to answer for what happened outside Kandahar, and people in this building right now who work for them. I'd rather not let them walk out." What followed was not the quiet, procedural cleanup that hospital administrators would later describe in their official statements. It was fast, and it was frightening, and it involved 2 more men in false uniforms being taken down in a stairwell by a security team that Ashcombe had quietly deployed hours earlier, anticipating exactly this outcome. It was Elena standing in a hospital corridor at 4 in the morning, giving a statement to federal investigators with the same flat, precise clarity she used when describing a gunshot wound, while Feld stood beside her, arms crossed, ready to vouch for a story most of the hospital staff still couldn't fully believe. It was Whitfield, hours later, finding her in the empty cafeteria and sitting across from her without asking permission. "I've been doing this for 22 years, he said. "I have never seen hands move like yours moved tonight." "Combat teaches you things civilian training doesn't," Elena said. "You don't have the luxury of slow in some places, and in others, slow is the only thing keeping someone alive. Knowing the difference is the whole job." "Teach me," Whitfield said. "Teach all of us. If half of what you know can save lives in this hospital the way it saved that man tonight, I want it institutionalized, not buried." 6 weeks later, St. Catherine Medical Center opened its first Combat Casualty Trauma Fellowship, a program designed to bring battlefield-tested trauma protocols into civilian emergency care, built and led by a woman most of the staff still called, half in awe and half in affection. Nightingale Dr. Marcus Feld became its first fellow, trading his old certainties for a strange, humbling apprenticeship under the nurse he had once told to move faster. Reyes recovered fully, testified under strict protection against the men who had sold his convoy's coordinates 4 years earlier, and showed up at Elena's first departmental lecture in civilian clothes, sitting in the back row with the quiet pride of a man watching someone he owed his life to finally stop hiding from it. Ashcombe kept his word. Her clearance was restored. Her record was corrected. The name Nightingale 6 existed again, not as a ghost buried in a sealed file, but as a title stitched onto the sleeve of a program that would train dozens of combat medics to bring their impossible skills into ordinary hospitals without losing themselves in the process. I used to believe that hiding was the only way to survive what happened to me. I spent 3 years convincing an entire hospital that I was slow, unremarkable, forgettable, because forgettable felt safer than the truth of what I had done and lost and carried. It took a dying man whispering 4 syllables into a room full of strangers to remind me that the truth doesn't disappear just because you stop saying it out loud. It waits. It waits for the moment you're needed enough that hiding becomes impossible, and it hands you back everything you thought you'd buried, all at once, all sharp edges and hard-won mercy. I am Elena Voss. I was Nightingale 6. I am both of those things now, standing in the same daylight, and for the first time in 4 years, I am not afraid of anyone finding out. If this story moved you, if you found yourself holding your breath in that trauma bay right alongside her, tell us where you're watching from tonight, and let us know what you would have done in Dr. Feld's position, standing in a room where everything you thought you knew about someone turned out to be wrong. Like this video, leave a comment and subscribe for more stories like this one, because the truth, no matter how deeply it's buried, always finds its way back to the surface. The weeks after that night did not move the way Elena expected them to. She had imagined, somewhere in the back of her mind during those long years of quiet hiding, that if the truth ever came out, it would arrive like a verdict, sudden and absolute, the world reshaping itself in an instant around the fact of who she really was. Instead, it came slowly, in pieces, the way most true things did. There were meetings with hospital administration that stretched for hours, men in suits asking careful questions about liability and licensure, and whether a nurse who had performed an unauthorized thoracotomy in their trauma bay represented a risk they could not afford to carry. Whitfield sat through every single one of those meetings beside her, and when the hospital's chief counsel suggested, delicately, that perhaps the incident should be quietly filed away and forgotten, he was the one who said no. "I have been practicing medicine for 22 years, he told the room, his voice carrying the particular authority of a man who had never had to raise it before to be heard. I watched that woman save a man's life with her bare hand inside his chest cavity, while I stood there useless. If this hospital does not find a way to keep her, to use what she knows, then this hospital does not deserve the reputation it has spent decades building." Nobody argued with him after that. Elena's medical license, suspended somewhere in the wreckage of her discharge 4 years earlier, was reinstated within a month, expedited by a federal recommendation that arrived on hospital letterhead she suspected Ashcombe had quietly arranged. She was no longer a nurse. She was Dr. Elena Voss, attending trauma surgeon, and the badge felt strange clipped to her coat, heavier than it should have been for a piece of plastic and a photograph. Feld found her in the equipment room one evening, sorting through a supply cart with the same unhurried precision that had once driven him to fury. "You're still slow," he said, leaning against the doorframe. "I'm exact," she corrected, not looking up. "There's a difference. You spent 3 years mistaking one for the other." "I know that now," he said. "I've been thinking about something you said that night, about knowing the difference between when slow keeps someone alive and when it kills them. It's the whole job, Elena said. Teach it to me properly, Feld said. Not in some emergency, not with someone's life hanging over both our heads. I want to actually learn it. So she taught him. It became a standing arrangement. 2 mornings a week before the department opened, Elena walking Feld, and a rotating handful of residents through the logic of combat triage. The strange mathematics of scarcity that governed every decision on a battlefield where there was 1 surgeon, 1 bag of blood, and 6 wounded men who all needed it at once. In a civilian trauma bay, you have time most days, she told them, standing at a whiteboard with a marker in her hand, sketching the anatomy of a chest wound with quick, sure strokes. You have imaging. You have specialists on call. You have blood banks stocked deep enough that you rarely have to choose who gets the last unit. In the field, you have none of that. You have your hands, your judgment, and about 4 minutes before a decision becomes irreversible. So how do you decide? A resident asked. Who gets the 4 minutes? You decide based on who can be saved, Elena said, not who you want to save. That's the hardest lesson there is. Wanting has nothing to do with it. If you let wanting into that decision, you lose more than the ones you couldn't save. You lose yourself, piece by piece, until there's nothing left running the show but grief. The room went quiet at that. The particular quiet that came when people realized they were being told something that had cost the speaker more than the words let on. Reyes came to visit her often during his recovery, sitting in a wheelchair in the physical therapy wing with the restless energy of a man used to running 6 miles before breakfast and now confined to careful, deliberate steps between parallel bars. You look like hell, he told her one afternoon, grinning despite the effort the sentence clearly cost him. You look like a man who got shot in the chest 2 months ago, Elena said. I'd say we're even. I looked for you, he said, after a moment, his tone shifting, after they discharged you, after the report got buried and nobody would tell me where you went. I asked around for almost a year before command told me to stop asking. I didn't want to be found, Elena admitted. I thought if I disappeared completely, whatever got those 4 soldiers killed would disappear with me. I thought I was protecting people by vanishing. You weren't protecting anyone, Reyes said gently. You were just alone. There's a difference. She didn't have an answer for that. Not right away. And he didn't push her for one. It was Ashko Mabe who eventually brought her the file she had spent 4 years not letting herself ask for, sliding a sealed folder across a table in a quiet conference room 3 months after the shooting, his expression unreadable. Everything, he said. The convoy route, the intelligence chain, the names of the men who altered it. It's all there. I thought you deserved to read it before it goes to trial. Elena opened the folder with hands that did not shake, because by then she had done the work of learning that they didn't have to. The truth, when she finally read it in full, was uglier and smaller than she had imagined it during 4 years of half-formed nightmares. Not some vast conspiracy of ideology or grand betrayal, but a handful of men protecting a contract, a supply chain worth more to them than the lives moving through it. Willing to let a convoy walk into an ambush rather than risk exposing an arrangement that made them rich. 4 soldiers had died, so a paperwork trail could stay clean. She had spent 4 years believing she had failed them, that her hands hadn't been fast enough, or her judgment hadn't been sharp enough, when the truth was that no surgeon on earth could have out-operated a betrayal that had been arranged before the wounded ever reached her table. "This wasn't my failure," she said quietly, more to herself than to Ashcombe. "It never was," he said. "I am sorry it took 4 years and a bullet in Sergeant Reyes's chest for you to hear that from someone who could prove it." Something in her chest loosened that day. Some knot she had carried so long, she had forgotten it was possible to exist without it. She did not cry in front of Ashcombe. She cried later, alone, sitting in her car in the hospital parking garage, with the folder closed on the passenger seat beside her, letting 4 years of grief move through her all at once, finally with somewhere to go. Grief that had nowhere to go, simply calcified. She had learnt that much from every soldier she'd ever treated for the wounds nobody could see. This grief, finally, had a direction. It went into the work. The Combat Casualty Trauma Fellowship grew faster than anyone at St. Catherine had anticipated, drawing interest from 3 other regional hospitals within its first year, each one wanting a version of what Elena had built almost by accident on the worst night of Daniel Reyes's life. She traveled sometimes now, teaching seminars to civilian trauma teams on techniques that had, until recently, existed only in classified after-action reports and the muscle memory of soldiers who rarely spoke of what they'd survived. She kept her hair a little shorter than she used to. She stood a little straighter in hallways. She still moved at the same unhurried pace she always had, checking twice what needed checking twice, refusing to let panic dictate the speed of her hands. But nobody in that hospital called it slow anymore. They called it Nightingale pace, quietly, half-joking, the way institutions build folklore around the people who change them. Feld became, in time, one of the fellowship's strongest advocates, publishing a paper with her on integrating battlefield triage principles into mass casualty protocols, his name listed second on a document that would go on to be cited in trauma programs across the country. "I used to think civilian medicine and combat medicine were 2 different disciplines," he told a room of visiting physicians during one conference. Elena standing beside him at the podium. "I have come to understand that they are the same discipline, practiced under different amounts of mercy. The mercy of time, the mercy of resources. Dr. Voss taught us what to do when that mercy runs out." Whitfield retired 2 years later, and at his farewell dinner, in front of the entire trauma department, he stood up with a glass raised and said the thing he had apparently been waiting 2 years to say properly. "The best surgeon I ever worked beside spent 3 years in this hospital, being told she moved too slowly," he said, looking directly at Elena across the room. "I have spent every day since that night trying to move as deliberately as she does, and I have never once managed it. Some of you will get the privilege of training under her. Do not waste it." Elena did not know, in that moment, quite what to do with a room full of people looking at her like that, so she simply raised her own glass, the way she had learned to do in another life, in another kind of room, among people who had also once needed something from her that only her hands could give. She thought, sometimes, about the 4 soldiers whose names she still kept written on a small card in her wallet, not as a burden anymore, but as a kind of ledger she owed nothing further to, its balance settled by truth rather than silence. She thought about the version of herself who had walked into St. Catherine Medical Center 4 years ago, asking for the quietest, most forgettable job available, believing that disappearing was the only mercy left available to her. That woman had been wrong about almost everything except one thing. She had been right that her hands still knew exactly what they were doing. It had simply taken a dying man's whisper, 4 syllables long, to remind the rest of her that the hands were never the problem. Reyes eventually returned to active duty in a limited capacity, training incoming medics on combat casualty care, and he made a point of visiting St. Catherine every year on the anniversary of the night he had been shot, always finding Elena in whatever hallway she happened to be standing in, always saying the same 3 words before he left. "Still the right call," he'd say, and she understood by now that he wasn't just talking about the thoracotomy anymore. He was talking about the choice she'd made in that hospital corridor at 4 in the morning. The choice to stop hiding. The choice that had cost her the safety of anonymity and given her back something she hadn't realized she'd lost until she had it again. Herself, whole, unburied, unafraid.